Hey there, it's Dr. Cammisa. Welcome back to our video series, and today I got two things to talk about. How the power plate pulse targeted vibration works on the body, on the spine. So stay tuned, I got lots to share. All right, welcome back to our video series, and I've got some fun today because not only do I have a spine, not only do I have the power plate pulse, boy, say that fast 5 times, power plate pulse. Anyways, but now I also have a big chunk of steak. And you're probably wondering, what am I going to do with this steak? Well, I'm definitely not going to eat this. I'm not even sure what that is. But we did some interesting testing the other day. I had my doc here, my orthopedic specialist, Dr. Irizarry, who's also an ultrasound specialist. And we were testing out some shockwave equipment. And during the testing, I decided to go get the power plate pulse. Boy, I said that good. The power plate pulse. And see what that actually does to the muscle tissue under ultrasound guidance. And you're going to see a video clip from the ultrasound and what the muscle tissue, what's actually happening in the muscle tissue when the vibration's going through it. It's a really cool video clip. Okay, so stay tuned. So do me a favor, okay, so we're gonna, you got this, you got the side of this? You can really see the wave being created. So talking about the targeted vibration, the power plate, we've been using vibration instruments for a long time, for probably a couple decades actually. And when we started, and I've been using power plates since about '04, but when we started using this guy here, which has only been the last several months, this has really been a total asset to our practice. And because it does have several different attachments and we can focus on different tissues, but one of the coolest things I like about this thing is that it has a dual stylus on here, and the dual stylus can actually go and look on the spine here. So one of the things that we'll do, depending on the patient and depending on the case that we're working with, is that we'll actually get the muscle and the spine to loosen up prior to the adjustment. And why that is so cool, and like you're going to see in the video clip here, because you're going to see the wave of vibration that actually works through the tissue. And as that vibration is working through the tissue, and I did another video on the science of the vibration. I'm not going to get into that, but as the vibrations going through that tissue, we're getting that muscle tissue to relax, increasing the blood flow, decreasing the spasm. And so it's really helped us out a lot from the clinical side. But I also wanted to mention on the personal use side, because we have a lot of patients that have these, and I wanted to bring up like the dosage of power, like how much do you use this? How often do you use this? And so when we look at this, we have different, like I said, we have different attachments. So let's just say, for example, that we're working on your shoulder here, okay? And we're going to be using a soft tip. How much should you use this? Well, if you think about this, like anything else that you're trying to do with your body, you're trying to get your body to recover. So your body needs time to recover. I had a patient the other day tell me they use this 3 times a day, every single day. Well, I'm going to tell you that's overuse. That's overuse. You've got to give your body a chance to rest and recuperate and heal the tissue. So if you're working on tight areas on your muscle tissue, and you're going to focus on, if you're going to get very specific, or the little targeted bullet guy here, if you're going to get very specific on an actual trigger point or a muscle knot, you can't beat that up 3 or 4 times a day, every day. You've got to treat that area and leave it alone for a day or so. So I like to say, if you're going to do a very specific trigger point area, you want to work on that area about every other day. And so you want to stimulate and activate that area. And if you're doing the shoulder area, so I'm just going to turn this guy on. And if you're doing the shoulder area and you're going to work through a range of motion while you've got that going, well, that's great. But you want to give the muscle tissue a chance to rest and recover, okay? So that's really my words of advice on the dosage, because I find that people overuse these and they're creating actually so much trauma to the muscle tissue because they're just not giving the muscle tissue a chance to recover. So my recommendation is every other day, if you're working on a really tight and painful area, every other day, let the tissue recover. You're actually going to get more benefit from that than hammering it 2 or 3 times a day every day. So once again, we are always bringing in new tools to the clinic, new technology to help us get better results with the spine and empower people to live their best day every day. So if, like I said, if you're new to our channel, please subscribe to us, share us with your friends, and until next time, have a fantastic day. God bless you, and we'll see you next time.